Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. This is the CX Matters podcast today with Brittany Watson. Brittany, please introduce yourself and your role currently.
Hi, everyone. My name is Brittany Watson. I am currently an advisor for Press Ganey.
Welcome to the CX Matters podcast, a production of the American Journal of Healthcare Strategy, with your host, Cole Lyons.
Everyone, of course, watching this, of course, the CX Matters podcast, probably very familiar with Press Ganey, one of the kind of leaders in the customer experience, patient experience space. You have a lot of experience, though. You've been, from looking at the LinkedIn resume here, working in the patient experience area for many years. It looks like about 10 years or so if you add it all together, right? I think that's about
Yes, it's been a long time.
It's impressive. It's really, really excellent to see people committed to it. And then, of course, you just recently received your master's degree, and it's a unique master's degree. And that's kind of where I want to start off with. Can you tell us a bit about how you came to find this master's degree and what it is? Because you're only, as you told me before the show, in the second cohort. So that's really impressive.
Yeah, so I would be remiss if I didn't give a shout out to Ashley Elstro, who I worked with when I was at Innova. She introduced me to the program. So Michigan State University offers the program online. It's completely online. It's a 20-month accelerated program. They are the first university in North America to offer it. So very exciting. I'm part of the second cohort. So I believe there's only 24 of us. It may not even be that high that have our MSCXM. So it's really exciting. It's offered through their Broad College of Business. So I really happened upon it because of Ashley. Otherwise, I'm not sure if I would have known about it, especially because when she told me about it, the program was so much in its infancy, and it has since grown in popularity. I believe there's 2 other cohorts that are going through it now. So yes, very excited to have my master's and have gone through the program. It was a great experience.
Huge congratulations. Huge
Thank
congratulations.
you.
That's awesome. So I have to ask, right, with all this experience, why not get an MBA, go into investment banking, right? What is the reason for staying with patient experience? Why do you like it and enjoy it?
Oh, I would never do investment banking because I do not have the brain for that. No, so
No, I'm sure you do.
Um, so this program absolutely spoke to me because I've always loved experience as a career. I didn't even realize that you could have a career in experience, but I knew even from being very green in my career, and I mean, when I was working in high school in retail, that I wanted to deliver exceptional experiences. And I think that that stems from being an empathetic person and really caring about how people feel. And when you have a negative experience, you know that that can make or break your relationship with a brand or a company. And so I was really excited that finally there was a program where it spoke to everything that I wanted to do. I went through numerous different master's degree programs and I was interested in them, but nothing really resonated with me the way that this one did. And everything that I was learning and did learn was either applicable next day or it was something that would be talked about in work at some point, and then I could relate that back to something that I had learned or it would come up later in the program. So having exposure to education that I could immediately apply and was so relevant to the work that I was doing and I do now is just invaluable. So I'm very excited that the program exists. And anyone that's interested in entering CX as an occupation, or if you're currently in it, I highly recommend checking it out.
I want to talk about it real quick too, because you're kind of one of the first people here, who are this new, brand of CX where we have the certifications, we have the degree that previously wasn't around. Like CPXPs are getting much more common now.
Mm-hmm.
So can you just explain what is the difference between customer service and this CX, right? That was something we talked about before the show. Can you explain that to us?
Yeah, so I often get asked what's the difference between patient experience and patient satisfaction, right? It's just easier for me to think about it in PX terms because that's
No,
my
that's
bread and
perfect.
butter. But even with CX, it's and customer service, when you're talking about it in a patient experience lens, patient satisfaction is asking, did it happen, essentially? And how would you rate how it happened? But when you're talking about patient experience or you're talking about customer experience, you're asking, how did you feel when this happened? And that's a huge difference. So I could go in and have an okay experience when I have a transaction, or I can go into a doctor's office and they could say hello and everything could be baseline, right? Just like a fine experience. But you can make or break someone's emotions basically with the type of experience that you deliver. And I'll give an example of this. So, I'm new to North Carolina and I had to establish care at my new OBGYN because I suffer with endometriosis and I have to have continued treatment for it. So I was trying to establish care with a new OBGYN and the wait was considerably long. Um, I wasn't being informed of how much longer it was going to be. I had to keep going up to the desk, asking how much longer it was going to be. Finally, I had to reschedule because I had already been there for an hour past my appointment time. Um, when I said that I needed to reschedule, no one apologized to me. Um, when a nurse came up and finally called my name to take me back, I was already in the process of rescheduling. And I asked her, should I even reschedule or how quickly can I be taken to the back? And she was like, well, you should just go ahead and reschedule because there's 3 other patients in front of you. No empathy, no apology. And when I asked her if it was standard to not apologize to patients during wait times, she said, and walked away. So, how did that make me feel? Well, I'm in pain. I'm there because I need treatment. I'm new to the area. This was my first experience at this OBGYN office. And I left that clinic feeling like I didn't matter and my pain didn't matter and I just felt awful. She made me feel less than in 2 seconds. And it broke my heart because I strive in my career to ensure that experiences like this don't happen to patients or don't happen to customers, but they do. And that is why experience matters. Now I will not go back to that OBGYN. Their brand reputation in my mind is shattered and I won't recommend them to other people. So it may seem like when you're talking about these things, it's like, well, this is just one person that had this experience. But if I've had this experience, other people have had this experience. And that's why creating positive experiences is so critical. It's critical to your brand reputation and loyalty, but it's also critical to the mission and values that I'm sure are undoubtedly written on that clinic's website. Like I'm sure that they have this whole blurb about how they're here to help their community and be there for every patient, or something along those lines that you see every time you read mission statements associated with healthcare. And none of that was lived up to that day. So there's such a huge difference between patient satisfaction and patient experience. Like they didn't do something well, which is the satisfaction piece. But on top of it, they made me feel like I didn't matter, which is the experience piece. And on top of if you didn't do something well, but you treated me exceptionally, you can maybe rebound from that. But if you do both of those things poorly, there is no rebounding and the trust is completely broken. That was probably a long-winded answer, but that's the
No,
best
this
way I can
was
describe it.
I'm actually really glad that you thank you so much for opening up about this
Of
because
course.
it's so important to realize this, right? It's hard to understand unless you can grasp the patient journey. And the issue is, first of all, they would have had no clue that you had just moved there, right? But look at the
Mhm.
impact that that has.
Mhm.
I want to ask, right? Did you leave a, and you don't have to answer this, did you leave a review?
So I actually spoke with the manager and I left her a voicemail. She called me back. She was very kind when we spoke. And I did have a follow up appointment because I needed to get my medication. So I'm going to treat with somebody else, but I had to get my medication. So I kind of had no choice but to go back for the consult. But what struck me is that she knew that I scheduled another appointment and she did not call to ask how the appointment was afterwards. So she had the opportunity to do continued service recovery and do continuous listening, and she didn't. And it probably did not occur to her that that would have been a best practice, and that's a failure. If you are not going the extra mile after you have recovered the service, even, you should continuously listen to that patient and continuously build upon a trusting relationship with them to build that loyalty and to show that you have respect for that patient. But she never did that. And that is such a failure in terms of the opportunity that she had. And I went back and I still did not have a great experience. It wasn't the same experience that I had the first time, but she knew that I worked for Press Ganey. She knew that I was a consultant and I worked in patient experience, and I would have been the perfect candidate to get that feedback from. She didn't. So
Yeah.
I can't believe that she didn't capitalize on that opportunity.
Because press gain is expensive.
Press game is expensive, and they have a survey that they sent out after the fact, which is, just kind of one of those quick, like, I don't know if it's like a Survey Monkey or whatever, but they're clearly tracking the experience. So then it goes into another conversation about, you're tracking this, but then what do you do with that data? Are you doing anything with that data, and who has access to it? So if you're going to track the experience, then please, when I give you the feedback, make me feel like it matters.
In your experience, right, you've had years of this where you've been helping members or patients with problems. Do most patients actually make it known that they've had a hard time or have a problem, or do they mostly just not?
This episode of The Strategy of Health was sponsored by Modality Global Advisors. Modality Global Advisors optimizes hospital revenue, enhances patient experience, and delivers proven results. Visit modalityglobaladvisors.com to learn more.
It's an interesting question because I used to be a patient advocate, and oh man, the amount of grievance letters that I wrote in my time as a patient advocate, I probably wrote hundreds and hundreds of letters in that 3-year period. But I would say that so many patients don't make it known at the time. They will make it known after the fact, which is hard for the organization because it's really difficult to recover the service at that point. But that also is on the organization to make sure that you have processes in place where you are using listening tools, whether that's through an electronic rounding system or you're going in and speaking, to the patient and just doing a typical round or a nurse leader round or whatever. Or when you're doing bedside shift report and making sure that you're engaging with the patient and that their needs are being met. I would say that there's a lot of missed opportunity to actively address or identify issues at the time of care. And then you have to work harder to perform service recovery if you find out about the situation after the fact. But I would also say that a lot of patients don't know that they have ways to express concerns during their care, which also falls on the organization. The organization, whether you're inpatient or outpatient or whatever, you need to be alerting your patients that if you have a concern during any point of your care, there is someone that you can talk to and to escalate that. But for patients that are new to healthcare, maybe it's their first time in an emergency department or it's their first time as an inpatient or whatever, they may not know that any of these resources exist to them. So it may seem like it's silly when you're talking to someone and they're like saying that they had a negative experience. I mean, my soon-to-be sister-in-law just had a poor experience at a clinic and she didn't say anything at the time. And you think like, well, why didn't you say something? But that's really not fair to the patient and putting the ownership on them. Like, why didn't you say something? Because if you had a process in place to pulse check what was happening during that visit and round on them, or even if you're not a leader that's performing rounding and you're a nurse or you're a tech or whatever, making sure that that person is having a pleasant experience and that their needs are being met. So there's multiple points in a patient's care journey where that should be happening, but it doesn't. So patients either don't realize that the opportunity is there for them to discuss concerns, or they do it after the fact, sometimes because they feel more comfortable than bringing it up. And then that also goes into, are you creating a culture of safety, and what are your perceptions of safety like for your patients? So it's very layered, but the processes need to be in place that you are doing continuous listening for your patient, no matter how short their visit is.
This is really, first of all, this is a great advertisement for the master's program, because you can tell you're like really knowledgeable about this. But I'm actually really, I'm kind of learning a lot just from what you're saying for my day to day job. But I'm going to ask you a tough question here. And this is not against any particular professional, this is against the system that creates this. But one of the problems is that we do these things. We go in, we tell the doctor, you need to be nice to your patients. You know, we go into the nursing station, we install these things that will alert the nurses if the sound level in the nurses station is too
Yeah.
high, and then they end up getting unplugged, right? We've done all these interventions that don't really seem to work. Why does that happen? Why do we do these kinds of things over and over? But more importantly, why don't they work, right? What actually needs to take place other than scolding, a doctor who's, seeing so many patients and really doing his best, or installing these devices that clearly make the nurses not feel very respected? What is the solution to some of these issues from an organizational level?
So I will say that, like any career path, healthcare or education, or if you work in the food service industry, whatever, some people do not belong in the roles that they're in, right? It's like you can just tell that they don't have the passion for it. So I will say that if you're working in healthcare and you're working with patients, either in person or you're not on the front lines, you have to have a passion for it. So the passion has to be there. However, the passion is there for so many healthcare workers. But the problem is that the culture of the organization often does not support that passion. And what happens? It leads to burnout. And then you try to implement patient experience processes that don't work, and you didn't get engagement from the frontline teams that are supposed to be doing this work. And they feel like they're just getting more and more dumped on them when they have a million other things to do. Right. So I will say this and maintain this until the day that I die, that patient experience or customer experience in general cannot happen unless you have employee experience. If you do not take care of the person that is taking care of your patient or customer, then you can just forget about trying to deliver exceptional patient or customer experiences to your clients. It's not going to happen. It's not going to happen because this nurse who is supposed to be delivering an exceptional patient experience can't, because she feels uncomfortable in her work environment, or she's being harassed, or he doesn't have the tools that he needs to do his job, or he was thrown onto a unit that he's not familiar with because they needed coverage on that unit, or there are unsafe nurse to patient ratios. So if you do not have a culture in place where you are supporting and caring for your employees, then you can throw whatever sound machine on the unit that you want, and you can tell a doctor up and down, you need to be nice to your patient, which is another conversation, because experience is so much more than about being nice, right? When I talk about patient experience, I am talking about the entire experience. So yes, being kind and compassionate and having empathy towards your patient is a factor in it. But experience is also related to safety and trust. And do you have highly reliable processes in your organization where you're not going to have sentinel events, and you know that your nurses are going to feel comfortable and confident in the care that they're delivering. And then their patients are also going to feel that. So the reason why these initiatives do not work is because the culture does not exist for them to work. And I will say this from experience that a lot of times leaders and executives are out of touch and they want results quickly, but culture takes time to build. And you can't just throw a dart at an initiative and be like, okay, we're going to work with this for like 6 weeks and now this doesn't work. So now we're going to put something else on, our teams. Nothing is going to devalue patient experience more than that, because you're saying that it's not important that we're going to stick with this initiative. Now we're moving on to something else. And imagine the eye rolls that your nurses are giving when they hear like there's something else that I have to do. Patient experience needs to be embedded into the culture so that it's part of daily work and it doesn't feel like it's siloed or additional work. So I really try to move away from saying PX, and I like to say human experience, which is what we talk about at Press Ganey, because I don't want to just talk about the patient. The patient is a factor in the entire experience. But I need to make sure that everything is going well for that caregiver also. So that's why these initiatives don't work, because the culture is not supported to make them work. And if you want to see real transformative change in your organization, you have to start with your employees. And that's through engagement and making sure that the rewards programs that you have for them make sense for them, and we're not constantly just giving nurses pizzas for doing a good job. Are we giving them a program that is going to benefit them as a person and them professionally? I don't see that enough in healthcare, and patient experience, customer experience will not and cannot exist if you do not have a culture where your employees feel valued. You can try it, and I will tell you it's impossible to make it work. And you can keep continuing the cycle and hiring more and more employees, but you're just filling a space and not appropriately tackling the problem, which is culture. And no one wants to hear that because it's hard, but it's possible.
No, I completely, and that's the scary part too, right? Is you cannot throw more money at it either, right? Salary
Mm-hmm.
caps out at somewhere. I mean, yes, like we'd all like to make more money, and that's fine to say,
Yeah.
right? But if you're being subject to violence at work, if
Mm-hmm.
as a nurse, how much money until you are okay with that? Probably, I mean, I don't really think there's going to be an amount, right? Especially if you're already making enough to provide for your family, another 20, 30,
Exactly.
40 grand. When we saw this during the pandemic, salaries
Mm-hmm.
went up and up and up and up, and nurses kept quitting, right?
Mm-hmm.
Some nurses were making $200,000 a year doing travel nursing,
Yeah.
and they were facing burnout. And so I think that's scary as well, because it's easy to raise salaries sometimes, but it's hard to actually
Mm-hmm.
like sit down and invest this time.
Yeah.
Why though is healthcare, and this will be the final question because I know you have so much going on, but uh, industry has done well in this, especially the automotive industry, traditional manufacturers for years have done well in this, right? They figured out the components that make a car feel premium. They figured out how, if you want quality to go up, you have to pay your employees a lot, not just in terms of money, but also in terms of job security long term. Apple has done this, right, with the way that they build their stores. So a lot of industry has figured this out, right? Why is healthcare like in a completely different world sometimes when it comes to this, right? We're still associating, quality and experience with just being nice or just being kind, or we still have this idea that if you don't like your doctor, it's a bad experience. Instead of, if you don't like your doctor, we can give you someone else that you might mesh with better, right? We don't even think in that realm yet.
Mm-hmm.
Why is the industry like this? Any ideas on why we're kind of behind in a lot of these areas?
So it's so interesting. When I was working in California, there was a hospital that was trying to deliver luxurious experiences, right? They were trying to make your experience akin to you going to the Ritz, for example. If you wanted to have wine with your dinner and your diet allowed for it, you could. They were investing in these luxurious accommodations, and what was that doing for patients? And honestly, for some patients, it was turning them off. It was like, well, this is great that you gave me wine with my dinner, but I haven't seen my doctor in 2 days. So where is the priority? Are you going to be able to make healthcare a glamorous experience and feel like you're driving a Rolls Royce? No. Um, but what makes patient experiences exceptional are making your patients feel that they matter and humanizing the experience that otherwise can feel extremely dehumanized. So, when you go into a patient's room, are you sitting down in the chair and speaking with them and asking, "Can I sit down and talk to you?" Are you explaining that when you touch them, like, is it okay if I touch you here? Do you have a preference if I take blood from this arm or blood from this arm? Or do you have a preference for your blood draw? Would you like to lay down? As someone that's scared to death of having my blood drawn, there is nothing worse for me than having a phlebotomist that is unkind and isn't taking preferences into account. So I think that we're behind because it is very easy to forget that you're working with another human. You see them as a patient and you see them as whatever is listed on their chart. And it is so common for us in healthcare that we have these tasks to do. We have to get this done. We're so busy. We have to do this charting, and I have to go see this patient. And it's very easy to be on autopilot and like lose sight of the setting that you're in. Whereas if you're in another industry, it's very easy to be like, this is a customer and I am trying to sell them on something. So I want to give them the best experience, right? But in healthcare, that's so much harder. And these people are coming to you probably at the worst times in their life and the scariest times in their life. And it may be end of life for some people. And that's hard on the patient's families that come in as well. So it's difficult, I think, sometimes to pull ourselves out of the fact that this isn't just a patient, this is a person. It's not enough to care for our patients. We have to care about our patients. And that's a distinction that I think is very important, but it gets lost in healthcare. And if we can try to remember that humanizing care is so important and will result in a luxurious experience, because that's really the best thing that you can do for your patients is humanize what they're going through. That is how we will get ahead. But it all comes back to, do you have a culture in place where you are making that possible for your caregivers? And that is the battle that organizations have to face. And if you can foster that culture, and it is not a question for these nurses that this is the type of care I'm going to deliver to my patients, and I can do it because I know that I have the support of my leadership and I have the processes and tools and education that I need to do my job well, then everything else will come.
Very incredible advice and very motivating. No, really, seriously, very motivating
Oh,
because
thank you.
healthcare is not people are not products, but yet they are, the services are, but it's services on the person, right?
Yeah.
So it's completely different, but it does get lost in the providing of the care. And so, really good advice, and I couldn't appreciate you coming on more, Brittany. Thank you so much. I hope we
Oh,
can
it's
have
a
you on
pleasure.
again.
Thanks for having me.
Yeah, no, thank you, and let's stay in touch. Let me know, and of course you'll become a professor, so we can all enroll in
Oh,
your.
yeah. I wish one day.
Yeah, but let's stay in touch, and what a great episode. We'll have you on again.
Awesome. Thank you so much.